Marijuana legalization impact on physicians and public health. Purpose is to analyze the impact marijuana legalization could have on public health. The audience is the public and marijuana users. In the introduction, it says marijuana is legalized for medical use in 23 states and the District of Columbia. Colorado, Washington, Alaska, Oregon, and the District of Columbia legalize marijuana recreationally, but marijuana is still a Schedule I controlled substance federally. Marijuana is a complex combination of more than 100 different chemicals. These components include delta-9 tetrahydrocannabinol, cannabidiol, cannabichromene, and cannabidivarin. Potency of marijuana has increased from 1% in the 80s to 9% in 2008. More research must be done in order to change legalization. Typically, marijuana is consumed via smoking joints or blunts. THC is absorbed rapidly and will produce effects within minutes. Oral doses are different. They delay for effects for 30 to 120 minutes. This prolongs the action of the drug, and once you take it, you cannot reduce the dose. Oral THC is available for the treatment of HIV/AIDS and nausea/vomiting related to chemotherapy. Common qualifying conditions for medical marijuana include cancer, glaucoma, epilepsy/seizures, Alzheimer's, and PTSD, but further research is needed for clinical efficacy and potential risks of smoked or edible marijuana versus oral/nasal cannabis extracts. Marijuana use in adolescents is associated with unemployment, lower income, and lower levels of life and relationship satisfaction. There is fear that if legalized, the perception of risk will decline and will cause the increase in use. There is a shown increase of use in New Mexico from 2011 to 2013, according to the Youth Risk Behavior Survey. The Ogden Memo is a memorandum issued by the Obama administration essentially decriminalizing medical marijuana at the federal level, and future research must be done to clarify relationships of decriminalization, legalization, and prevalence. There's a concern that adolescents will have access to cannabis from adults with legal access. Between October 2009 through 2011, in Colorado, there were 14 pediatric unintentional ingestion ER visits. No clinical trial that has evaluated the use of cannabis as a treatment for chronic pain allows patients to lower their dose of opioid analgesics. States with medical marijuana laws have higher rates of opioid overdose mortality than states that don't have those laws. Further research must be done to examine relationships between marijuana and opioid use, as well as whether patients can use marijuana to treat pain and be able to lower their opioid analgesic. Marijuana is the most common illicit drug reported in motor vehicle accidents. Studies show that marijuana affects many cognitive and motor skills that are involved with driving, including reaction time, attention, spatial working memory, and time and distance estimation. Although those are all true, that finding that a driver of an MVA tested positive for marijuana does not mean that the marijuana was the cause of the accident. Marijuana is linked to various health outcomes, including addiction/dependence. 1 in 10 adult users of marijuana develop addiction, impaired cognition, slower reaction times in non-chronic users. There's no significant difference that were observed in a cohort of very heavy chronic cannabis smokers. And lastly, pulmonary effects. Studies implicate cannabis consumption as a risk of lung cancer. Evidence shows that marijuana may interfere with the drug concentrations of warfarin and antiretroviral therapies. Further research must be done to see how components of marijuana interact with other medications in a clinical setting. Each section ends with the fact that more research must be done in order to really understand the effects of marijuana, so that's how it all comes together in unity. Each section is organized to give the reader information needed to understand the next section. They build the base of knowledge and add on the known research of legalized marijuana, medical marijuana, etc. And lastly, rhetorical appeals. Logos is mainly shown in the article because many statistics and studies are used. For example, I have the quote, evidence also suggests that cannabinoids may transiently lower intraocular pressure, suggesting promise in the treatment of glaucoma. And works cited, this is the article that I used. That's it.